anticipated. Well, so many of us have had virtual medical appointments during this pandemic as our use of technology rocketed forward. Joining us to talk more about how he's been working with patients is Dr. Zweibel, System Director of Cardiac Electrophysiology at Hartford Healthcare's Heart and Vascular Institute. Doctor, welcome.
Thank you, Lisa. Thanks for having me.
Thank you. Well, even before COVID, you were involved in virtual health and using it for your patients. Explain how and why.
Yes, so we implant devices like pacemakers and defibrillators in patients, and about 2-3 weeks afterwards they need to come back in to see us to make sure the device is functioning well and the incision is healing. And we thought this would be a perfect use for virtual health, so we could actually do all of this, check their device and wound from home using virtual health technology. And that was really going quite strong back when COVID hit in March.
Wow. So, all right, when COVID began to gain traction and virtual health, as you mentioned, ramped up, you were instrumental in spearheading training providers. Tell us about the work groups that were established and how you went about training staff and patients.
Yeah, so we quickly realized that in order to keep our patients and staff safe and to continue to provide access for our patients to receive medical care, we needed to really quickly ramp up virtual health. So myself and the entire village here, a lot of my colleagues worked very hard to get virtual health running within the system. Before March, the year prior, we did about 400 visits in the system, and as of yesterday, we did about 193,000 visits since the beginning to mid-March. And we put together websites for the patients. They can go to hartfordhealthcare.org/virtual health and get trained on how to use virtual health. They can make an appointment with a provider. And we also worked on a lot of educational material for our staff, our physicians and our medical assistants, to assist our patients in having a successful virtual health visit.
Wow, almost 200,000 visits. That's amazing. Do you think this is part of our new normal going forward?
Yeah, absolutely, Lisa. The genie is out of the bottle, as we say. Patients really enjoy this. Physicians enjoy using it. This provides improved access for our patients. Many of our patients are older. They may need to have a loved one take the day off from work to bring them in to see their physician, and they're happy. It provides a great experience. So these are absolutely here to stay within our healthcare system.
Yeah, I know a lot of low-tech people who easily did these and really enjoyed it. All right, real quick, one more question about implanted devices, people who need procedures. How are you handling their health?
Yep, so again, we are testing every single patient who comes into the hospital, either for a procedure or through the emergency room for COVID. We are, again, doing social distancing with our staff. Our staff is tested every single time we walk in the hospital. We're all wearing masks. Everything is being cleaned, so it's an incredibly safe environment, and we're really pleading with our patients that if you feel that you have an issue, whether it be a heart issue or any other issue, that it is safe to come into the hospital. Please don't stay home.
And that's a message I know we've been trying to help you get out there as healthcare providers, that you have safety measures in place. It is safe to go in to get treatment in the ERs. So thanks for reinforcing that, Dr. Zweibel. We really appreciate you taking the time to be with us today.
Sure. Thank you, Lisa.